Hey guys, it's Vinny, and let me tell you some things. Some things have been going on in my life, and none of them have been good lately. Absolutely none of them have been good. I wanted to come to you guys with this video because I really wanted to strike while the iron was hot, and I have a lot of emotions. I'm really overwhelmed, and I just gotta get this off of my chest, get this out there because I'm really enraged. And so let's just start with today. Take it one day at a time. Let's start with what happened today. So today I had an appointment with my psychiatric nurse, and I had like a whole list of things that I wanted to talk to her about. Now, just as a little bit of background, I'm not sure if I talked a little bit about it in my disability video or one of my videos. If I did, I'll link it up here. But at one point in time, just a couple days ago, my psychiatric nurse, I had asked her to fill out a form, basically to do my diagnostic criteria. And while I sent this form out to my therapist, and she was more than happy to comply with me, she goes pretty much above and beyond to do everything that she can to help me. I was told not by my psychiatric nurse, but by my therapist when I saw her, that, oh, hey, so and so gave me a note and said that they weren't going to fill this out for you. And that was the first sign of like, uh-oh, something's wrong, red flag here. But yeah, basically she was telling me that my prescriber, sorry, was not interested in helping me with my disability case because she felt that I was only temporarily disabled, or that I do have impairments and I do need assistance, but I guess not to the severity that she likes or whatever. She had some kind of differing in opinions or whatever. Which, to be completely honest, and I'm going to be really blunt with you guys, I don't know who gets to have a difference of opinion on my life, but I like to say that no one does. I mean, you can have all the opinions you want about how you think my life is going, all the opinions you want, but to be completely honest, you're a professional. You have a specific job to do, and in order for you to perform that job, you have to listen to your patients, your clients. You have to listen to them, and you have to be willing to trust them and trust their word and what they say. And if you're not even willing to do that, how can you make the assessment that, oh, I don't believe this client is doing this bad? Now, you would think if she were to say something like that, it would be like she has this lengthy history with me. She's seen me for a while, and she thinks like, oh, whatever. Like, even though I honestly wouldn't care if she had seen me for like 15 years and she felt that way about me, because I would still be like, well, you don't live my life. You're not in my head. You're not with me every day. You don't really get to say, how disabled I am or not. But she had only basically seen me, I guess, even though her start period was January of this year. Technically, she probably only saw me maybe 5 times. And I think that's being a little generous, but yeah, like maybe 5 times. And that's not a lot, okay? Like once a month, and then there was a break in that treatment because me losing insurance at a certain point in time this year. But how in the world can you base an opinion on someone for after 5 visits when you see that person in those visits for like less than 15 minutes? Like, seriously, how do you base your opinion on their entire life and say, you know what? I don't think you got it that bad. I think you're just fine. And like flat out refused to help me. So I was already thrown off guard by that. And I was like, okay. So my game plan was to go in there and hit her with everything I got, try to convince her, like, try to get her on my side, because in order for me to look good, when trying to get SSI to listen to me, I need to have my prescriber on my side. If my own doctor doesn't believe in me, they're not even gonna, like, even give me a second thought. They're not even gonna give me a moment of their time. So, I wanted to convince her and basically saying, like, okay, I don't think she has my psychological evaluation. So I faxed it to her. It's like, I don't think she has my treatment history with the hospital. Don't think she has that, and all that stuff and whatnot. So I faxed it to her, and I told her that I wanted to discuss it with her when we get together, because I basically want to paint a more vivid picture for her. Having seen me only a handful of times, maybe she really doesn't have a lot that she's pulling these opinions from. Maybe she really thinks, oh, well, she doesn't seem as bad as she makes it sound because I'm not seeing this. I don't have it recorded. Alright, well, so I'm like all prepared for this. I'm so freaking nervous. I have like bullet points written out, and I'm like scripting this, and I'm trying not to have a panic attack. Seeing her. Get into her office. And before I can even say a single thing to her, because I'm just like, alright, this is your moment to shine. She's like, alright, hi. And then hands me this piece of paper. She's like, I just wanted to let you know that I will no longer be treating you. And I was so shocked and so stunned by that move, by that shady ass move, that I didn't know what to say. Like, I seriously, when I was bullet pointing, like, trying to prepare myself for this conversation, trying to be like, all right, to lessen my anxiety and whatnot, I did not consider the fact that she was just going to drop me. That she was just going to say, actually, I'm not going to help you at all. Bye. So when she said that, I was just like, oh, okay. And so she was trying to explain something, which I think is absolute BS, but she was phrasing it in a way where she's like, after going over your stuff, and you sent me a lot of faxes. I mean, I got the stuff like 10 times. And first of all, I could like already hear the kind of the friggin' rudeness in her voice. Like, I can hear that sniffiness, and I'm just like, so I explained to her, like, alright, well, what happened was my fax on my side said it was unsuccessful, so I resent it. Like, it's no big deal, girl. It's no big deal. She's like, oh, okay. But yeah, and she's like, I got that, and then after, like going over with so-and-so, my consulting physician, I've decided that, I need you to see a board certified, psychiatrist. And because I don't do this kind of thing. And seriously, I almost lost my freaking mind when she said that. But again, I was so stunned that any of this was even happening to me that I didn't even have a chance to respond. But in my head, I was like, it's not your job to do this? Like, I was like, then what's your freaking job? Like, if it's not your job to help a client that's asking you for assistance, what the hell are you doing? Like, what do you do? What services do you provide exactly? So, yeah, she's telling me this thing, and then she's like, going over my prescription, she's like, usually when we do this kind of, severing of ties here, we kind of leave you with 3 months medication, so it gives you kind of a holdover until you find a new psychiatrist. I was like, okay. So she's going over my medication. She's like, do you have enough escitalopram? I'm like, yeah, it's fine. And then she's like, all right, and Ativan should be the same, right? I'm like, no, actually, because what I was going to tell you was that I started for a month now taking Ativan every single day at 1 milligram, and it's not enough. And she was like, but your prescription is 0.5. And I'm like, yeah, but it says I can take it twice. She's like, ah, yes, it does. I'm just like, girl, you don't even know. You don't even know what you've written to me. Okay, girl. But yeah, she's like, Alright, I don't normally do this because I'm not gonna be there to follow up on you, but I will up it to 1 milligram twice a day. I was like, alright, thanks. Thanks, that was very considerate of you. But yeah, and then she goes over to my Topamax and she's like, so yeah, like I don't even know if you're even bothering taking Topamax. And it's like, it was like the attitude that she had. Like, it's like as if she already had this assumption of me that I was not compliant. And I was like, yeah, I am still taking Topamax. Why would I not be? And I was like, I'm taking it at the 12.5 that you directed me at, and it's not working. Like, it has no mood stabilizing effects whatsoever. And then she decides to say, oh, actually, I told you that you can increase your dosage to 25 milligrams. And I was like, well, actually, it's literally the only time I actually stood up for myself. Because of these other things, I usually just said it in my head because, I just didn't know how to respond. But this is the one time I was like, well, no, actually, because when I was at that dosage, remember, I was going to sleep for 15 hours a day, and I can't have that. And then she was like, oh, oh. And I'm like, oh, what? Like, okay, like, all right. And she's like, well, I'm not going to change it. I'm going to keep it at that. And when you find your next doctor, they can do whatever with you. And I think out of everything that happened, that perspired today, that was the most upsetting thing. Because I was looking forward to this meeting because of the fact that Topamax wasn't working. Because I'm in desperate need to control my mood instability. Seriously, guys, it is killing me every single day that, like, I can't like cope with this very well. And I was thinking, oh hey, I can just talk to my freaking prescriber and, she'll either give me a new medication or adjust my doses or something like that. No, she's actually just going to freaking leave and be like, good luck with that. Good luck, girl. And I'm just like, what? So, yeah, not having a good week. So yeah, that's what happened. And I know, like, now I'm seeing, like, the time. Sorry, I was just so enraptured by this conversation. But it is getting a little long. But I will say that this week has been just a nightmare. On Monday, which was yesterday, on Monday, I saw a lawyer, and I was under the impression that this lawyer had already accepted to represent me to the appeals council. That wasn't the case. But even though it wasn't the case and he said he wasn't interested in doing that, he did meet with me for 2 hours and he gave me some fantastic advice, something that I never actually got from the lawyer that I did have. And he said he would be willing to represent me if I did something differently. I'll probably make a different video about that later on because I'm going to be doing this disability stuff for a long time, so you won't be missing out on any of that. But yeah, so that was already like a blow to me, yesterday, because I had to kind of rearrange, my plans, rearrange my thoughts. It's like, oh my god, I had this solid game plan and now it's like halted, shattered. Then I came in to her office today, shattered, before I even got a word out of my mouth. And I'm like, wow, this week's going pretty rough. All right, what else can we do? So, yeah, let me just tell you that I can talk all day long, up and down. I can write a freaking goddamn book about how wonderful and great and beneficial and important finding a good therapist is and how important therapy is in general. But I cannot say that I have had any luck or any good experiences with people in the field of psychiatry. I really haven't. And it sucks because I'm like, psychiatry is part of, counseling and therapy and stuff like that. But it's like, you guys are really making it hard for me to rep for you when you don't even want to freaking help me. Like, you seriously are just like, all right, and the thing is that she literally had that piece of paper, right? She had this piece of paper. She literally could have sent that in the mail and called me and say, hey, listen, I sent it in the mail. Like my lawyer did. She could have sent that in the mail. Hey, listen, I'm not going to basically help you out here. I'm not going to do it anymore. I'm just not. And that's what she could have done. But instead of that, she decided to make me come into her freaking office to drive 40 minutes to see her for less than 5 minutes just to drop me. I was like, that shady, shady girl. Like, she made me go there because she wanted to charge me. And I know that's what she did. Like, she just wanted to bill my insurance so that she could get paid for this. Because she wasn't going to get paid if she just sent me that letter. And I'm like, wow, girl. Really? But, yeah, like, seriously, when you're looking for your, you know, your psychiatric care, shop around. Make sure like you're already in therapy first. Like, don't let that be the first person you're looking for. Make sure you're already in therapy and shop around. You know your diagnoses, know everything that's going on with you, things that are happening in your life, and look around, because that's what I'm gonna have to do now, and tell these people up front what you need, what you're looking for, what you have, and what you will not tolerate. So that way you can kind of avoid the situation where, all of a sudden, when stuff gets a little bit more difficult and they're like, hey, I need your support with that, they don't go, bye. So, yeah, find yourself, take a little bit of extra time and care trying to find your psychiatric support. So, that's really all I have to say about that. I will see you guys soon. I know I keep saying, oh, this video is already long, but I know some people like these long, kind of ranty videos, but I will be, I am in the process of producing a video series, a mini series for you guys, and I just want to show you a little bit of a little preview. I mean, it's not really a preview, but like, I'm gonna cover the title. But yeah, like, this is all my work. Like, here's this, and this, and this, and like that. So it's like, I've already written out all that stuff, I scripted it, and it's basically gonna be like a part one of a 2-part or 3-part series video. And it's a topic that really means a lot to me. I'm really passionate about, and it is a mental health topic. But it will involve talking about gender identity. It will involve talking about sexual orientation. So definitely do stay tuned for that. Most likely will be filmed this week, but will be shown next week. So that's it for you guys. I feel a little bit better getting that off my chest, so, take care, and I hope you guys are having a better week than I am, and I will see you again next time. Bye!